Welcome. I'd like to present a short course on HCG therapy for weight loss known as the Simeon Protocol. Dr. Simeons was a British physician who employed the use of HCG, which is human choreographic gonadotrophin, for weight loss. He's been doing it and has been done for approximately the last 50 to 60 years. It's been done all over the world and has a incredible safe track record. Now, let me explain to you how it works. HCG is a bioidentical hormone. It's the hormone of pregnancy. So basically, if I was to ask you the question, if you were to get pregnant right now, and I was to put you on a special diet and gave you some vitamins and said, okay, the baby's going to be fine, don't worry about the baby, but you're going to go on a special diet that has no fat, what do you think would happen? Well, most of you are thinking to yourself, well, the body would take all my fat to feed the baby. And that's exactly what happens. Is that the HCG basically gives your brain a scent for your fat. And then when you go on to a special diet that I'm going to tell you about in a minute, your body goes gangbusters after the fat and you lose approximately 20 pounds in a 3-week period. There is a protocol where you can go longer, and I've had people lose 30, 35 pounds in a 40-day period. But generally, the 3-week period works for everybody well, and you can lose between 20 and, say, 25 pounds in that period. Now, how does it work? Well, basically, it starts out in that you give yourself a shot, which I show you how to do in the office. It uses a very, very, very tiny needle. So most people coming in, once I show it to them, even when they are nervous and they don't like needles, they go, oh, that was nothing. So you give yourself a shot every day for 23 days. For the first 3 days, or 2 to 3 days, depending on how long you've had the weight, you basically are eating as much fat as you can. So I know that sounds funny, but for the first 3 days, you're binge eating. Now, I basically tell the patients, don't eat a lot of carbos. You can, though. But what I'd like you to eat is things like organic sour cream, butter, eggs, fat, because the idea is to put the fat high in your blood so that when you go to the diet, which is basically just a low-fat diet for the 20 days that are remaining, what happens is your body is going to go and burn up all your fat. And that's the strategy here, because what's happened is the fat that you're holding on to right now. And for those of you who are watching this, I'm sure many have had tried different diets, from Weight Watchers to Jenny Craig to Atkins. I mean, you're diet experts out there. And that's what happens when people are coming in. You guys are just diet experts. Everybody is. But what the HCG does is it makes your body see the fat. Because you all know when you've lost weight before, a lot of times you lose muscle. You lose the weight, and then what happens? You go back to eating normal and you gain it back, and then some like gangbusters, and that's the problem. Well, with the HCG, what's happening is it's forcing your body to burn up the abnormal fat. So that's why the book that I have for download at the bottom of this page actually is called Pounds and Inches. Because not only do you lose pounds, but you lose inches. You actually lose inches on your legs, on your arms, on your waist, in places that you couldn't believe. The skin stays toned. You don't get flabby. It's really a miracle therapy. And I'm making this video because I've answered a lot of questions for people, and I have so many people who are thrilled with the results of this therapy and have had absolutely no complications or problems with patients doing it. In other words, they tolerate it, they're able to do it. Most people say, oh, I don't even feel like eating, because what happens is the HCG is actually helping your body not feel hungry. That's the way that it's working. So you are doing a low-calorie diet, but you're actually not bothered by it. So it's real simple. I have a cookbook that I can supply you with that has wonderful recipes that actually we're using at home now just on a normal basis because the recipes are so good. I show you how to do everything that's related to it. Basically, to get going is as simple as getting some basic blood work to make sure that you're in a healthy state. And then us having a physical exam and just moving forward and getting you on the program. So HCG can be a real powerful tool for weight loss that you can utilize to really help shift your body. For many of the people in my practice, it's been a miracle because, as you can imagine, I'm dealing with a lot of weight loss, and it's really been a tool that has helped a lot of people. Now, I must say, I usually use it in people who have tried, who are really working hard, who are really trying to eat well, and they really have come up against a wall. And for those people, it's been miraculous. I tend not to want to use it for people who are still eating poorly, still haven't maintained the discipline of really trying to lose the weight, period. But generally, most of you who are going to be viewing this are working hard, are interested, are looking how to better yourself. And as far as I can see, this HCG, and I've done it on a lot of people, has really been something miraculous. And if you have any questions, you can give us a ring at the clinic. I'll be happy to talk to you, answer any further questions you may have. I hope that this was useful to you, and I look forward to seeing you. Have a great day.